Between 40 and 55 years of age, whether you're a man or a woman, sleep problems tend to affect you more. And you should ask the question, why? I encourage people to ask this question, why, in response to pretty much every problem that people face. And that is not asked often enough. So I just want to repeat myself to say, if you feel you're having sleep problems and you feel that this is because you belong to a certain age group, ask the question, why? So in case of men, for example, their body is changing. Women, particularly, their hormones are changing in this age group. Universally, people have more responsibilities, more demands that are on them to do more, to make more money, to work harder, to take care of their family, to save for their retirement, or whatever else. So there's more stress. There's more stress, and the body's changing. Not that it is anything good or bad about the body changing, it just changes, and you have to recognize that the body works differently as your age changes. How does it work differently? The body is way more forgiving, or seems to be, of lack of sleep when you're much younger than when you are a little older. And why do I say it seems to be? Because the damage that lack of sleep does to your body is still happening when you're younger. It just doesn't affect you as much at that time. It takes much longer for the body to have dealt with a lack of sleep or sleep problems until you start feeling those symptoms. So in this age group between 40 and 55, very often people start experiencing more symptoms. Not that they haven't had problems earlier on. What kind of symptoms? If somebody snores and does not breathe well enough while they're sleeping, that lack of good quality sleep will affect them. How will it affect them? They may feel tired or sleepy in the morning or during the day, or now chronic illnesses start affecting them as a result of these sleep issues. So blood pressure goes up, blood sugar goes up, and so on. Weight starts changing. And hormones change in men as well as women. And we have to recognize that hormones have a very strong effect on the brain. So in terms of excitement, in terms of alertness, in terms of activity level, in terms of being able to sleep deeply, all of those things are affected by the level of male and female hormones. So particularly women, as they go through menopause, they have hot flashes, their mind seems to have more difficulty winding down at night. They tend to have more insomnia. They also put on more weight as part of the hormonal change. Weight gain can make sleep apnea worse. Sleep apnea makes weight gain worse. The more the body's in stress, the more it wants to slow down metabolism. Very common observation, people will say, I eat the same that I used to, I exercise the same that I used to, but now I'm putting on weight. Why? And that is the reason I started this conversation with the question, why? The better you understand how your body needs to function at its best and how it is changing with age, the better you will be able to help yourself feel better and function at the best level that you want to.